How do anti-TB drugs reach bone tissue effectively? Imagine trying to send medicine deep into a fortress to fight an infection hidden inside. That's what anti-tuberculosis drugs do when they target bone tissue. These drugs mainly travel through the bloodstream, which acts like a highway delivering medicine to different parts of the body. Once in the blood, the drugs need to leave the blood vessels and enter the bone tissue where the infection is hiding. The ability of these drugs to reach the bone depends on their properties. Drugs with smaller molecules and moderate lipophilicity tend to diffuse more easily into bone tissue. For example, some drugs like linezolid have been shown to have concentrations in bone that closely match their levels in plasma, even at low points in their dosing cycle. This means they can maintain effective levels in the bone for a longer time, which is important for fighting persistent infections like bone tuberculosis. Bone tissue itself varies in how well it can be penetrated by drugs. Healthy bones have good blood supply, which helps deliver the medication. But when the bone is infected, especially in cases like Pott's disease, the structure can change. The infection can cause the blood vessels to become less effective or the bone to develop granulomas, small areas of immune response, that act as barriers. These changes can make it harder for drugs to reach the bacteria inside the bone. Another factor is how long the drug stays in the bone tissue. Some drugs can stay at effective levels for many hours after dosing, which helps keep the bacteria under control. For example, certain anti-TB medications like linezolid can maintain therapeutic levels in bone tissue even 24 hours after taking the medication, supporting sustained bacterial killing. Researchers are also exploring new ways to improve drug delivery to bone. One promising approach involves nanomaterials, tiny particles that can carry drugs directly to the infected area. These nanoparticles can improve how well the drugs are absorbed, prolong their presence in the bone, and reduce side effects. This targeted delivery could overcome some of the traditional challenges of penetrating dense or poorly vascularized bone tissue. In clinical practice, ensuring that anti-TB drugs reach the bone effectively is crucial for successful treatment. Doctors often monitor drug levels in the blood to estimate how much is reaching the bone. Because bone penetration can vary depending on the drug, the severity of the infection, and the individual's health, treatment usually involves a combination of drugs over a long period. This helps ensure all bacteria are eradicated and reduces the chance of resistance. In summary, anti-TB drugs reach bone tissue mainly through the bloodstream, with their success depending on their physical and chemical properties, the health of the bone's blood supply, and the changes caused by infection. Advances like nanotechnology are offering new hope for more effective delivery, which could lead to better outcomes for patients with bone tuberculosis. Always remember, if you or someone you know is being treated for bone TB, it's essential to follow healthcare provider guidance and discuss any questions about medication delivery or effectiveness.